Dan?
Yes.
Hi, my name is Kim. I'm a nursing student, and I was hoping I could watch you give some meds today.
Perfect. So I have Shanana O'Connor. She is 34 years old, and we're going to be giving her meds.
Super. Can I get an S-bar?
Yes. She's in room 231. She's a full code. She's 34 years old. This is Shanana O'Connor, okay? She has allergies to trimethoprim sulfamethoxazole. She was admitted for a fever of undetermined origin. It's only been complicated even more by her end-stage renal disease. She's on the transplant list, and she's noted a decreased appetite. She also has type 1 diabetes, so that makes it even more complicated. Her last set of vitals was at 101 temperature, 95 heart rate, a 96 O2 sat, and 138/78 blood pressure, respirations of 20. Okay, so that temperature is high. The doctor seems to think it might be a UTI because of the increased fever. There's one other lab in here that is of note, and that's the decreased urine amount, which is why she is decreased urine. But then we also did labs of her urine test, and the white blood cells came back really high. Usually it's 0 to 4 range, and she came back almost 15. So that's why we're thinking that our patient also is suspected of having a UTI. She is on a renal diet. Because of the end-stage renal disease, she's not able to excrete as much fluids as we would like. So we're only, when we do hook her up to the normal saline that we will be given today, we'll only be doing it at 30 mils an hour. Okay, continuous IV. But it's only going to be 30 because we don't want her to fluid overload.
Sure.
Let's see. So she is on a 1,500 mil daily fluid restriction. She has a little bit of non-pitting edema in the lower extremities. She had a history of smoking, but she got rid of that 2 years ago. Last pain was 4 out of 10. Tingling in the lower legs. So we do have one IV. We do have one IV in her right median vein that we're gonna be using to flush, to assess, and all of that. And then we are going to be giving her the continuous infusion of sodium chloride and also the imipenem, which is her broad-spectrum antibiotic. And the reason that we're giving her the broad-spectrum antibiotic is to knock out the infection before it goes anywhere else. And we're acting prophylactically here.
Okay.
Okay?
Can you tell me specifically why the client will be receiving that med? Yeah.
So the imipenem, like before, like I just said, is a broad-spectrum antibiotic. My doctor thinks that if we treat we treat whatever conditions that she has prophylactically right now, that we're going to be taking care of it before it actually spreads and becomes a bigger problem than we already have.
Okay. And what action does the med have on the body?
So what it does is it combats all of the it combats the bacteria and doesn't allow it to reproduce into any more bacteria, and then further complicates the bacterial cell walls by destroying them.
Okay. When should you question administering the medication?
So you want to question administering when the person has with other carbapenems, because she does have an allergy to trimethoprim sulfamethoxazole. So other carbapenems, penicillins, and cephalosporins. Also, pregnancy can be an issue. So we want to make sure that we're not doing administering any of those simultaneously. Other than that, tramadol can increase risk of seizures.
Okay. Which vitals must be monitored?
So we want to monitor temperature and pain levels specifically. If it is an infection, those will be the first to skyrocket and go up.
Okay. Which physiological parameters should be monitored when the medication is being given?
So like I said before, we drew her labs, and her labs were really high in white blood cell counts. We want to look at the white blood cell counts.
Okay.
And we're also going to do a culture. If the white blood cell counts go back down to between 0 and 4, we know we've eradicated it, as long as the cultures come back negative.
Okay.
Number one. Number two, you also want to just look at her IV insertion site to make sure there's no phlebitis, no inflammation, no infection, and no infiltration.
Okay. What interventions must be taught to the client to ensure the medication is administered safely in the hospital and at home?
So we just want to check the IV site for phlebitis, pain, inflammation. It's never going to be administered at home. This is a parenteral IV administration, so we do it right in the hospital. She never has to worry about even touching the stuff. Just don't yank the cord, please. That's all we ask of her. And then we're just going to make sure that she's monitoring her own site. Excuse me 1 second. The storm is really bad outside. I really apologize for that.
What are the side effects and potential adverse reactions?
So the side effects are dizziness, nausea, vomiting, diarrhea. We want to watch out for those things.
Okay.
But we also want to watch out for anaphylaxis and rash. Anaphylaxis can be life-threatening.
Okay. How will you know if the medication's effective?
So if we see the decrease in temp, and we see the decrease in the white blood cell count, and then we see a negative culture results, then we're good.
Okay. I have no further questions at this time.
Great. So before we go in there, we just want to check the doctor's orders with the MAR to make sure that the medications all line up. So I see this doctor's order here says sodium chloride 0.9% normal saline, and the MAR, the medication administration record, says it's 0.9% normal saline at 30 mils an hour. So we're all good. We have to verify that it's the right time. So we just did. We verified that it's the right time. And it is time to give this medication. We have to verify that this is the right patient. We are making sure that it is Shanana O'Connor that we are about to go in. I'm just kind of peeking in the window to just make sure she is who she is, and then we're going to double check and triple check and quadruple check. Okay? So I got Shanana O'Connor here. That's what the doctor says. She's 34. It says 34. We're all good. We're making sure that this is the right route and the right dose. This can only be given this way, continuous IV. And then the right dose is just as right as well, with the 30 mils an hour. Imipenem is also in the doctor's orders. We want to make sure that the pharmacist, or we check with the pharmacist and the drug guide, and that's all right here. Here's my drug guide that I was personally using. I also called the pharmacist to make sure that this patient was able to receive this medication, and they gave it a go. The doctor gave it a go. I'm giving it a go from what I read. So I think it's time to give this imipenem, even though they do have this allergy. This allergy does not, or the imipenem does not affect the allergy. Okay. So let me just start by before we go into the room, I got to pull these drugs out of the MAR. So looked at the doctor's orders. Now I'm pulling them out. Here we go. This is our sodium chloride, 0.9% normal saline. Just making sure that it is perfectly sterile, which is this perfectly sterile, and that the expiration date is okay, and that is totally true. Excuse me 1 second. This lightning is getting to me. The expiration date is perfect on here. There's no contraindications that I see up in here. There's no cloudiness. It's no rips, no tears. It looks structurally sound. Now we look at the imipenem, and we're going to see the same thing. Imipenem, Cilistatin, 500 milligrams, IV piggyback, Q8 hours, and we're going to deliver this over 1 hour. It also looks great. The expiration is within normal limits here. This is perfectly sterile, so I'm just checking to see that everything is okay. There's no cloudy mixtures, and we're looking okay. No tears in the bag, and it's not ripped, okay? So without further ado, we're going to get in there and identify our patient, and then we're going to get to administering the medication, okay? All right. Hi, my name is Dan. I'm going to be your nurse today. This is Vicky. She's going to be your student nurse today. So we've just come to give a couple of meds to you. One being sodium chloride, just normal saline. It's part of your body, of what you do. And then we just hook it up to you, and it just goes continuously. Are you familiar with sodium chloride?
Yes.
Perfect. And then imipenem Cilistatin. Do you know what that is?
I don't.
Okay, so the doctor, I don't know if he's come in and told you yet, but he might think that you have some sort of a UTI, as evidenced by your pain and the temperature that you're producing right now, your fever, and then also by some cultures that we did. You have an elevated white blood cell count. So we're going to act prophylactically, which means we're going to act like kind of before and make sure that we knock everything out that's in there, possibly before, anything gets any worse.
Great.
Good. So, this drug, do you know anything about it?
not anything.
Cool. So I just want to tell you about it real quick and then give you some material. Imipenem still is satin. It is a broad spectrum antibiotic, and it can have some side effects. I need you to look out for like a rash. I need you to look out for vomiting, nausea. I need you to look out for dizziness. I need you to look out for diarrhea.
Okay.
If you have any of these things, you need to tell me.
Gladly.
You have the call light right next to you. I see that. It's perfect. But just in case you don't have the first one, I can give you the second
Thank
one.
you.
Perfect to call light. So before I touch anything, I just kind of want to wash my hands. So here's my hand washing. I'm washing. I'm washing. I'm washing. These are hands, and these are being sterilized. Okay.
Thank you.
They're all sterilized. Now that I've told you about that, I'm going to put on a glove real quick, and then I want to give you some information that you're going to teach me back later on.
Sure.
Okay, so this is some information about the drug and its effects, okay? I'm going to take off this glove. I'm just going to wash my hands again. Never can be too careful with washing of the hands, okay? So we've, before I can give this medication, now I'm going to actually don the glove. I'm going to do a couple things. I'm going to flush her IV site to make sure that the IV site that we want to put the med into is not infiltrated, it's not inflamed, and it's just good. That it doesn't have phlebitis, that I can give it. So we're going to go look at that. Lord have mercy on my soul. We're going to go look at that. So and then we're going to flush it. I'm going to set up these meds, and I'm going to ask Shanana O'Connor her name and her age just to double confirm with the Mars. So this will be our second. Okay? Okay, so this is a perfectly sterile syringe right here filled with normal saline that we're going to be flushing. It's actually on this arm, my dear. Thank you so much. There you go. So your name is Shanana O'Connor, and this is your number, and I scanned it, I typed it into the computer, and it does confirm that you are who you are, okay? So what is your name?
Shanana O'Connor.
And what's your age?
34.
Perfect, thank you.
Mm-hmm.
Okay, so now we're just going to check to make sure that the site right here is not inflamed. It looks great. It looks dry, cool, clean, intact, not raised, and all of that. And then what you do, in order to flush, you take your swab and you swab the hub for 15 seconds because this isn't dirt. This isn't clean, sterile. So scrub, 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 scrub. Boop. Okay, great. This is all sterile. We'll scrub, 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 scrub it again because it just dropped. So scrub, 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 scrub. 15 seconds. Great. This is sterile, as I just said. So you just insert it on. Squirt a little in to make sure that it doesn't raise up. We're monitoring. It's not raising. Do you have any pain?
Mm-mm.
Great. Okay, so we just let that go. We'll have to scrub it a little bit later as well, but at least we're done there. Okay? Alright, now we can go and start typing in the information that we need in order to properly give this sodium chloride. So, let me just, Shanana O'Connor.
Mm-hmm. Yes.
Okay, I have your patient ID scanned, so it's perfectly in the computer. Just wanted to make sure I scanned my medication, and I did. And I have a green light that says I'm ready to give the sodium chloride. I just wanted to double check that you know about your allergies, and you just have that one allergy, right?
Mm-hmm. That's it.
And what is it called?
The one I can't say.
Great. So it's the trimethoprim sulfamethoxazole.
That's it.
Okay. And do you know anything about that one?
Not really, no.
Great.
It
Why?
just makes me itchy.
Got it. So I double checked with your doctor to make sure that you can take the sodium chloride and the imipenem with this allergy medication,
Okay.
or with your allergy.
Okay.
Okay.
Good.
Perfect. So this is all sterile. Wouldn't you believe? It's all so sterile. And in lieu of having a pump today, because the power is oh so conveniently going out, in lieu of having a pump, we have something called the Dialaflow. It works the same way. Where is my Dialaflow?
It was up
I have it. It's right here. This is my Dial-A-Flow. Sorry about that. Again, this is so perfectly sterile. Everything is so unbelievably sterile here, folks. So what you do is, being that everything is so sterile, you want to first clamp. You want to clamp your tubing so that no water runs through it and out, okay? Clamped. Then you're going to take your sodium, and before I do anything, I'm just going to label my tubing for you have about 72 to 96 hours worth of life on each tubing before you have to replace it. So I labeled it, and I have my tubing ready to go. That way everybody knows the date, the time, and my initials, and the date of the next change, okay? So now what you do is you're going to take this bag, you're going to sterilely, just so sterilely unclamp it and insert, make sure you don't touch anything, this inside this bag and flip it upside down. Okay, and now we can hang this. Okay, perfect. It's all labeled. And then what I have to do is, all of this stuff is sterile. It's all so sterile, and none of it has ever hit the ground. This is the Dial-A-Flow. This is... Perfect.
Okay.
I love this. So this is the Dial-A-Flow. In order to prime all the tubing, you have to set the Dial-A-Flow all the way to prime. So it says prime right there, right there.
We haven't had a storm like this in a long time.
I know, this storm is killer.
Mm-hmm.
It is trying my patience. So you just hook everything up, and then I have this wonderful prime bucket. So basically, you let the fluids go. You let the fluids go, and it should just automatically come right out.
I see movement.
I do too. And then you just want to let a couple of drips out, so that way the entire bag is so perfect. The line has 0 bubbles in it. I'm just going to clamp it again. And we're going to get ready to administer, or to put it into the IV. So I've already checked once and twice that it's ready to go. So we're just going to scrub the hub. This is sterile still. Scrubbing the hub, and then we're going to, for 15 seconds, and we're just going to insert clip, and we're ready to go. Okay, so this takes care of the medication administration number 1. So I just need to do, what I need to do with this is set it to 30. I'm going to set it to 30 right here, so that way it's just so perfect. Okay.
So that tells you how much I'm getting.
Yes, this determines the rate. So with setting it to 30 mils an hour right here, you're only going to get 30 mils an hour now.
Okay.
So now we unclamp it, and we are ready to go. Okay, so then we just type in all of the stuff that we did, and we document, and we press save. Okay. Time to administer the second med. So we're just going to go ahead and type in the patient ID. And what is your name and date of birth?
Shanana O'Connor, and I'm 34.
Great. And I'm just going to verify that for the 3rd time. I'm going to verify that for the 3rd time on her bed, and she is in fact Shanana O'Connor. And I'm just going to enter in the information so that way we get hopefully a green light. 290.
I went to this hospital where they could scan your bracelet.
I bet that was wonderful.
It really was.
I think our hospital does offer that, but the thing is that the power outage is so real right now. We don't have access to much equipment.
Mm.
We're kind of using
Old
archaic,
school,
archaic equipment. I have a green light. I'm just before I even go on to this next medication administration. I just want to wash my hands again. I mean, look at these hands. They are just so clean already, but I might as well wash them. Don some new gloves. That way we have just a nice fresh pair on, okay?
I like it clean.
Thanks. You know, while I'm here setting up this next thing, do you want to tell me some of those side effects that I told you about?
Yes. Diarrhea, vomiting, dizziness, itching.
Perfect. You have learned.
Mm-hmm.
So that's what you're going to be watching out for right now, right?
Yes.
Okay.
Then I'll tell you.
Great.
Mm-hmm.
That's why I like you.
That's why I like you. Looking out for me.
Look at that. Oh my goodness. Here we go. Okay. Here's the independence. Completely sterile. Here is our secondary line, which we're going to put another label on that's perfectly dated and initialed and everything, and we're just making sure that it has no, like, it's all sterile. Everything is so sterile. We're just making sure that it doesn't have any, like, tears or rips, and it looks all good, so everything is capped and super sterile. Okay, here's another label that we put on there, just like that one. We did the same thing here. Now, here's the thing. We have to check for Y-site compatibility. So we have to go at the highest site, which is up here. We have to scrub the hub here. So I just want to show you. We want to make sure that this looks like it's intact. And we definitely checked the meds before for Y-site compatibility. Okay? And they are compatible. So now that I want to make sure that my scroll is in locked down position, so that way I can not have water leaking through it. So what I'm going to do is sterilely unplug this, insert this. Now we have our med. I'm going to take this, sterile swab this portion, because I think I might have knocked it on something, and you can never be too safe. So you sterile swab that, and you're gonna sterile swab this for 15 seconds, all of it. All of it gets sterile swabbed. Okay? Now, I'm gonna sterile swab that again in a second here, but just to be safe. But I just wanna do something real quick with this. I need to prime it. So the way that you prime this antibiotic, you don't wanna lose a lot of the fluid, so you only slowly release the antibiotic till just a couple drips come out, and perfect, just a couple drips came out, so the line is completely air bubble free as I'm looking at it. Okay, now the thing is, before I release any of this, I have to do something. I have to bring this fluid down, because you basically want this one to higher up due to gravity, because that'll flow through this first instead of allowing this one to go through it, okay? So while I'm hooking this up, I'm actually going to stop this, put it in the off position, so now it's stopped, okay? I'm going to sterilize yet again the Y-site compatibility, sterilize for 15 seconds. And they're all sterile, everything's sterile. I don't know how many more times I can say the word sterile. Hang it up. Okay. Now that this isn't off, so everything is stopped. Okay, I can also put this in off too, but it doesn't really do anything because this one's in off already. So I'm just going to keep that one on. I'm going to let this one go. And now I'm going to take my Dialaflow and set it for the proper mils per hour here, which is 100, and it's going to infuse over the hour. Okay? So we made sure that all of our things are ready to go. And they are. And do you feel any pain, any inflammation, any swelling?
It just feels cold.
Okay, good. So we are in good shape. So I'm just going to go ahead and type in the documenting information. I think I already asked you about your medication, but why don't you tell me again?
Diarrhea, vomiting, itching, rash.
Perfect. So we are going to just initial here. And do you need anything from me right now?
I don't.
You're good.
Mhm.
So I'm just going to finish documenting just this little bit here. If you give me just 1 second, I can actually take these gloves off because we're all done with them. Let me wash my hands before I touch the keyboard. That way we have that under control. So, administered imipenem IV PB 500. So I have here administered imipenem IV piggyback at 500 milligrams in 100 mils over 1 hour. Patient states patent IV site and confirmed with observation from the nurse. No infiltration or phlebitis. Let me save it. Okay, and so I'm just gonna keep documenting over here. Do you have any more questions for me?
I have a couple actually.
Okay.
Were there any pertinent pieces of information you reviewed before administering the medication to your client?
Okay, so Kim, right, nursing student?
Mhm, yes.
I wanted to, the things that I wanted to look for before administering the med to the client was, again, I wanted to make sure our IV site was okay, and I also wanted to make sure that the med was safe to administer to the client.
Okay.
I also wanted to make sure it was the right time, which I did. I checked with the doctor, I checked with the pharmacy, so we're good.
Okay. Did the information you found affect your decision to administer the medication?
Just even more so confirm the fact that I should be giving this medication to the client.
And did this information affect how you administered the medication?
The only thing that I had to do was make sure that it was done IV piggyback because you can't do it any other way.
Okay. I don't have any other questions.
Great. Well, I'm just going to continue documenting here, and we're going to call it a day.
All right. Thank you.
Thank you.